Hi, Dr. Gomez. Question for you on Gomez Cardiovascular. What does safety mean to your practice?
Safety, that's a good question. So safety is one of my most important values, I think. The way I see safety is, especially in the cardiovascular clinic, is let's say we're somebody's coming to us for a diagnosis or for a second opinion about vascular disease. Well, there's a lot of modalities, there's a lot of tools, and some of them carry a significant amount of risk. For instance, some of the stuff that I do in interventional cardiology requires invasive procedures and ionizing radiation to make a diagnosis. So I always try to first exhaust all non-invasive means or tools that do not require radiation. For instance, we focus and we specialize on and we use ultrasound technology, and we try to maximize the use of ultrasound technology because it is extremely safe and it is extremely effective in giving us a diagnosis and in helping us define cardiovascular disease in many patients, and then that way they can avoid invasive procedures or procedures that carry an increased risk.
So then, Dr. Gomez, one of your goals, in essence, is to keep your patients out of the hospital as much as possible.
Oh, absolutely, yeah. And even though I trained mostly in the hospital, my goal is to keep patients out of the hospital, yes. And if they do need to go to the hospital, my goal is to keep them in the hospital as short as possible, usually in an outpatient setting, if we use equipment in the hospital.
In today's scenario, the patients you see are generally complicated, meaning they have a lot going on, diabetes, other cardiovascular disease. Sometimes they come to you on 10, 15 medications. What would be your top goal with a patient like that?
Yeah, so yes, and that can be a serious problem for patients to come in with what we call as polypharmacy or multiple medications, because that adds a significant amount of risk to the. I mean, just imagine the liver having to detox patients from all these medications. Of course, we if it's a patient that we are going to manage and we're going to do, for instance, we're going to take care of them, we try to minimize the medications that we give them and try to get rid of any unnecessary medications, obviously with the help of their primary care physician. But yes, that would be one of the goals, to minimize medications.
All right. Thank you, Dr. Gomez.